Well, if you take medication every day, you're part of the majority of Americans. But how do you know what you're prescribed and what you're given is correct?
Well, tonight, THV 11's Erica Ferrando gives us a closer look at what we all can do to avoid medication errors.
Hey, Steve.
Getting your medicine is an easy process. Hand over your prescription, then receive the medication.
Take it with food.
82% of American adults take at least one medication a day, according to the Centers for Disease Control, keeping pharmacists filling prescriptions all day.
Per pharmacist, probably 125 or 150 prescriptions a day.
But what if you were handed the wrong prescription? Or what if your doctor accidentally prescribed you the wrong medicine?
Every day, the pharmacist is helping to correct dosage.
Because mistakes happen. Many of you know firsthand, saying, I once received the wrong birth control pills. I was given someone else's pills in my bottle. And I once noticed my dad's refill looked different. He started to fall and not remember anything. All because he was accidentally given the wrong medication.
The right drug at the wrong dose can be prescribed. The wrong instructions can be prescribed. It can be misinterpreted at the pharmacy level.
Scott Pace is CEO of the Arkansas Pharmacists Association.
A lot of selection errors have happened.
He says technology has created a new opportunity for error.
We've moved away from a lot of handwritten prescriptions to electronic prescriptions.
And when doctors send prescriptions electronically, they can easily click the wrong medicine without realizing it.
It's the technology that sometimes is changing what used to be a simple paper process and turning it into something on a computer, and it just is a different workflow. And so with that different workflow has a different opportunity for different errors.
Philip Way, pharmacist at Remedy Drug.
Rarely does it appear here.
He puts prescriptions through a triple screening process to make sure those mistakes don't happen.
There's a process of data entry.
So when he gets your prescription, he reviews the patient, the doctor, and what else the patient is taking. He finds the medicine, counts the pills, bottles them, then checks again.
Making sure that the right medicine's in the bottle, the right drug is on the label, the right doctor's on the label, and that the patient's not already taking it or taking something that would interfere with it.
But every year,
the CDC reports more than 1 million emergency department visits come from adverse drug events. That's any harm that comes from the use of medication, like allergic reactions, side effects, over-medication, and medication errors.
If it's a drug allergy, they could have an anaphylactic reaction. And depending on who they're surrounded by or how well they know how to handle that type of thing, I guess it could be fatal.
And the final step to make sure you're getting the right medicine is conversation.
Communication is very important to us at the pharmacy level.
That's a huge responsibility, not only to verify what's been prescribed, but then it's a huge responsibility inside the pharmacy once they've verified that what's prescribed is correct.
It's a responsibility for the pharmacist and you.
Tell them what's going on with your health care. They're going to protect that information, but they need to know, if you had a baby, if you just got over an infection.
If the color of the pill looks different than it did last month, ask. If the shape looks different, ask. If the directions look different, ask.
And ask again.
It's important that that patients have a relationship with a pharmacist, somebody they can talk to, somebody that has their profile.
Because when it comes to protecting your health,
there's no bad questions. We want the patient to understand what it is that they're taking.
Knowing exactly what you're taking is just another step to stay safe. Erica Ferrando, THV 11 News.
Scott Pace says some errors come from drugs that sound alike or with similar names. Now, the Food and Drug Administration reviews about 300 drug names a year before they're marketed, with about a third rejected to minimize confusion.